Hey, welcome back to Not So Complicated family. And if you are new here, I hope I can provide you high quality content in lesser time. So, this is episode 7 of 5 minutes, 5 high yield drugs. We are doing antibiotics like amoxicillin, azithromycin, ciprofloxacin, doxycycline, and vancomycin today. So, the amoxicillin, it belongs to class penicillin beta-lactam. The uses are infections like strep throat, otitis media, sinusitis, H. pylori, eradication, and the mechanism of action of this drug is that it inhibits bacterial cell wall synthesis by binding penicillin binding proteins, right? The side effects are rashes and diarrhea. Diarrhea because it inhibits, like it disturbs normal gut flora or microbiome of our gut. So that is why diarrhea can happen. And in rare cases, hypersensitivity reactions like anaphylaxis can be seen. The USMLE poll for this drug is that you have to combine with clavulanate or augmentin for beta-lactamase producing box, because beta-lactamase is an enzyme that destructs beta-lactam, right? So we cannot use beta-lactam antibiotics directly. We have to use clavulanate in addition to that for synergistic reactions in organisms like Haemophilus influenza. So it is also safe in pregnancy, that is, it belongs to category B antibiotic in pregnancy. The other drug that we have is azithromycin, and it belongs to class macrolides. The uses are community acquired pneumonia, chlamydia infection, pertussis, and COPD exacerbations also. The mechanism of action is that it binds 50S ribosomal subunit and inhibiting bacterial protein synthesis. So the side effects are QT prolongation, nausea, and in rare cases hepatotoxicity can happen. The USMLE poll for this drug is that a single 1 gram dose can be worked for chlamydia infection. And since azithromycin has a long half-life, it allows 5-day Z-pack regimens. This regimen contains 6 tablets of azithromycin, and you have to take 2 tablets in the first day. That is why it is 5-day Z-pack regimen. And there is a mnemonic for you. This is very high-yield mnemonic: buy at 30, sell at 50. A is aminoglycoside and T is tetracycline. So aminoglycosides and tetracyclines inhibit 30S ribosome, and cell, that is C is chloramphenicol, another C is clindamycin, and E is erythromycin that belongs to macrolides. So macrolides also inhibit 50S, all macrolides, and then L is lincomycin and another L is linezolide, right? So these drug inhibit 50S ribosome. So this is very high yield for you. The other drug we have is ciprofluxacin. It belongs to class fluoroquinolones. The uses are complicated urinary tract infections, pyelonephritis, anthrax, pseudomonas infections, right? So the mechanism of action is that it inhibits DNA gyrase and topoisomerase IV, blocking DNA replication, right? So the side effects are tendon rupture. Tendon rupture because it impacts the structural protein collagen. The metabolism of collagen, the formation of collagen is affected by this drug, that is why tendon rupture, there is a very high risk of it. And peripheral neuropathy, CNS effects like seizures or confusion can happen. And the USMLE poll is, it is contraindicated in kids under 18 except anthrax due to cartilage damage risk, the same reason of collagen. And we have to avoid this drug with dairy or antacids, because dairy or antacids reduce the absorption of ciprofloxacin and thus reducing the efficacy, right? So the other drug that we have is doxycycline. It belongs to class tetracycline. The uses are Lyme disease, Rocky Mountain spotted fever, acne, and chlamydia. The mechanism of action is that it binds 30S ribosomal subunit, preventing protein synthesis. We have talked about it in a high yield mnemonic. Side effects are photosensitivity, GI upset, tooth discoloration in children, right? The USMLE poll of this drug is that first line for early Lyme disease, that is erythema migrans, and we have to take it with water to avoid esophageal ulceration. And upright, you have to take it upright for preventing like erect or standing up, and the next should be straight to avoid esophageal ulceration. The final drug we have is vancomycin. It is glycopeptide antibiotic. The uses are MRCA infections like methicillin resistant staphylococcus aureus infections, or Clostridium difficile colitis, that is oral, and also endocarditis. Oral dose should be used in Clostridium difficile. And the mechanism of action is that it inhibits cell wall synthesis by binding D-alanine in peptidoglycans, so structure deformity will occur. The side effects are nephrotoxicity, ototoxicity, and red man syndrome. That is, there is extensive flossing due to histamine release. That is why red man syndrome. The USMLE poll is that we have to monitor trial levels, that is 15 to 20 microgram per milliliter for serious infections, and oral form used only for Clostridium difficile, not for systemic infections. So that is all for today. Subscribe for daily doses like this, and thank you for staying with me, and subscribe if you like this.